Hello, and thank you for joining the Integrating PSYCKES Consent into Workflows webinar. My name is Michelle Hand. I'm a research scientist on the medical informatics team within the Office of Population Health and Evaluation, and I'll be leading today's training. So here's our agenda for today. We'll do a brief PSYCKES overview about what PSYCKES is, what data is available, who is included in PSYCKES, etc. We'll go over the different levels of access to client level data, and then we'll talk about how to enable those access levels to the clinical summary. We'll also talk about policies and procedures, some PSYCKES consent frequently asked questions. We'll look at the registrar menu in PSYCKES and also our PSYCKES mobile app for the e-sign consent feature. And then we'll touch on training and technical support. So let's begin with our PSYCKES overview. So what is PSYCKES? The PSYCKES application is an online web-based application that's both secure and HIPAA compliant. And the purpose of PSYCKES is for sharing Medicaid claims and encounter data along with other state administrative data. And PSYCKES does this by putting this data into a user-friendly format that's both designed to support data-driven clinical decision-making and quality improvement projects that some of your organizations might be enrolled in. Now, the PSYCKES clinical summary is updated on a weekly basis, and then our quality indicator reports are updated on a monthly basis. So who is viewable in PSYCKES? The population available in PSYCKES, right now we have over 11 million New York State Medicaid enrollees, either currently or previously enrolled. We have those that are fee-for-service, managed care enrollees, including all product lines. We have dual eligible folks, which means they're enrolled in both Medicare and Medicaid. But just to note, the information in PSYCKES will only be for Medicaid data at this time. So for example, if somebody is a dual eligible individual and their medications are being paid for by Medicare, those would be missing from PSYCKES. However, any medications paid for by Medicaid would show up in our application. And then lastly, we have MAP Health Home Enrolled clients. So these are clients linked to a provider agency if they're enrolled in a health home or care management agency according to MAP. And then within that bucket, you also have to be a part of the behavioral health population to be in PSYCKES. So that means that you have a history of psychiatric or substance use services, psychiatric or substance use diagnosis, or any psychotropic medication billed to Medicaid. But once you're in the PSYCKES application, the treatment information will be across the spectrum, meaning you can see information on behavioral health and medical services, living support and residential, lab and pathology, dental and vision, etc. What data do we have in PSYCKES? So there's a lot of data funneling into our application, into the client level clinical summary. And again, that provides up to 5 years worth of data and is updated on a weekly basis. So we have two different buckets of data coming into our application. The first bucket is Medicaid fee-for-service claims and managed care encounter data. And the second source that we have is other state administrative databases. And these two data sources combined really help to provide that full clinical picture of the client. Now, in regards to Medicaid billing data, the timeline in PSYCKES can vary depending on a couple of things. So first, it depends on the type of information. Something like pharmacy claims, we consider those to be pretty quick and timely, with a typical turnaround time of 45 days or even a little bit less from the time the client picked up their prescription to when it hits our application. However, other services like inpatient and outpatient services, those can take a little bit longer from the time the service occurred to the time you'll see it in PSYCKES. And it could be upward of 3 to 4 months, maybe a little bit more, maybe a little bit less in some cases. Now again, besides the Medicaid billing bucket that we have funneling into the clinical summary, we also have our state administrative databases. And these sources are considered more real-time since the lag here is 0 to 7 days. So here's a list of all the state administrative databases that we have filing into PSYCKES. And our newest data source is the New York City Correctional Health Services data, which includes the provider name, the jail admission date, the jail discharge date, released to information, placed in jail, mental health, residential treatment, if applicable to the client, behavioral health diagnoses they received, medications at the time of their discharge, and then also any scheduled follow-up or referral information would be included. Next, we have the New York City Department of Homeless Services data, and this provides us with the shelter name, the program type and placement date, date and exit reason, and the shelter director contact information. Then we also have the DOH MAP, Health Home Enrollment and Care Management Provider data source. So if a person is in outreach or enrollment, we have the name of the health home and we have the name of the downstream care management provider. For managed care plan and HARP status, we get that from the managed care enrollment table. We get the managed care plan assigned primary care physician quarterly from the Department of Health. We also have state psychiatric center electronic medical records. So if a client has spent some time in a state PC and their inpatient unit doesn't bill Medicaid directly, you'll still get access to that data because we have this as one of our sources. And then next we have assisted outpatient treatment, provider and contact information that we're getting from OMH TACT. And then we have a couple of data pieces coming in from OMH Cares, and that includes the ACT provider and contact information for assertive community treatment, as well as adult housing and residential program information. And then next we have information coming to us from NIMERS, and this is going to show suicide attempt data. And this is actually one of the instances in PSYCKES where this data will not be restricted to the 5-year look back rule. So suicide attempt information is all available data, meaning even if an attempt occurred 10 years ago, that would still show up on the client's clinical summary because it's such important information. And then next we have safety plan screenings and assessments, and those are entered into PSYCKES by providers. Lastly, we have IMT, which stands for Intensive Mobile Treatment, and Assisted Outpatient Treatment Referral under Investigation, coming to us from DOH-MH. All right, so in PSYCKES, we have what is known as a quality indicator or quality flags. Now, OMH has identified a number of health conditions or treatment issues that are important enough that they're worth scrutinizing. So what PSYCKES does is it tracks clients who are positive for one or more of these health conditions or treatment issues. And that way the provider or the managed care plan or the county or state government leadership can be made aware and take necessary next steps. And these flags can assist with supporting clinical review as well as quality improvement. Now we have a number of indicators that are broken down into our indicator sets or buckets. So here are just a few examples of our quality indicators. We have health home related flags, and an example of this would be eligible for Health Home Plus, no Health Home Plus service in the past 12 months or the past 3 months. We also have flags that are medication related, such as polypharmacy. And an example of this would be a client who is on multiple antipsychotics or multiple antidepressants. And we have low adherence flags. So this would be an example of if a client has schizophrenia and started on an antipsychotic medication, but they didn't remain on that medication for more than 80% of their treatment period. They would be flagged for low adherence. We also have some hospital-related flags, one of which is our high utilization indicator set, and this looks at clients who have had multiple hospitalizations within the past 13 months. And we have readmission flags, so that's really for clients who might be cycling in and out of hospitals. Then our general medical related flags, an example of this would include someone who is on an antipsychotic but hasn't received a diabetes screening, or if someone hasn't had an outpatient medical visit in over a year, they would be flagged as well. And then lastly, we have our performance tracking measure sets. These are coming to us from the Department of Health and are run with an intentional 6-month lag to allow for complete data to come in. And an example of these measures would be no follow-up after mental health inpatient, 7 or 30 days, or no follow-up after mental health ED visit within 7 or 30 days. These are just a few examples of our quality indicators. I believe at this time we have around 80 or a little bit more in the application. All right, so we have a variety of different reports available in PSYCKES. The first and most popular report would be the client level clinical summary. And again, that includes that Medicaid and state database treatment history and provides up to 5 years worth of data. We also have provider level reports. So this would include my QI report, and that displays current performance on all quality indicators through a prevalence rate. And you can review the names of clients who meet criteria for certain flags and enable access within this report. And then recipient search, you can run ad hoc reports to identify any cohorts of interest. We have our recipient search advanced views on the results page, and you can also enable access here. Then we have our usage reports, and these are really used to monitor protected health information access by staff. And then our utilization reports, those were really designed to help support provider value-based payment data needs. And then lastly, our statewide reports. Here you can select a quality indicator and review statewide proportions by provider location, region or county, client residence region or county, plan, network, provider, etc. All right, so we're going to go into the levels of access in PSYCKES to client information. So first I want to explain how clients can be linked to your agency. So clients can be linked either automatically or manually. And to be linked automatically, that means that the client has had a billed service at your agency within the past 9 months, or the client is currently enrolled in a health home or care management agency according to DOH MAP. So that's how people can get automatically linked to your PSYCKES view. Now, manually is when the provider attests to one of the following through the Enable Access module. So you're going into PSYCKES and attesting that the client signed a consent form, either the PSYCKES consent, the DOH Health Home Patient Information Sharing consent, or a BHCC consent. You're attesting that verbal consent was obtained, that there's a clinical emergency, or that the client is currently being served by or transferred to your agency. So those are the ways you would manually link someone to your organization. I'm going to explain a little bit more about which of these levels of access mean. So the signed consent, again, that's PSYCKES, the DOH Health Home, or the BHCC consent. This level of access allows access to all available data within the clinical summary. So that's including data with special protections. And data with special protections is substance use information, HIV, family planning, and genetic testing. So it includes all available data with assigned consent for 3 years after the last billed service. Now with a verbal PSYCKES consent, meaning the client gave consent verbally, this allows access to limited data for 9 months. So that means you're not going to see that data with special protections with a verbal consent. Then clinical emergency, this allows access to all available data, including that specially protected data, for 72 hours. And then lastly, attestation of service. This will link clients to your agency for recipient search reports, but will not provide access to the clinical summary. Now, just to reiterate, without consent or emergency access, there will be no data provided without those levels of access. So users will not be able to access a client's clinical summary when they are linked to you solely via billing or via attestation of service. However, they will still be linked to your agency's reports, such as recipient search and my QI report. Now, the rationale is we've removed the quality flag level of access to help facilitate and support interoperability between PSYCKES and electronic medical records in order to help streamline entry of the PSYCKES consent and allow access of the PSYCKES clinical summary data directly within EMRs. Now, with signed consent or clinical emergency ER access, all available data is provided, meaning that you can access that client's clinical summary and view data with special protections. Again, that's substance use, HIV, family planning, and genetic testing. And with assigned consent, you'll be able to access that full clinical summary for 3 years after the client's last billed service at your agency, or until the client withdraws their consent, whichever comes first. And with emergency access, you'll be able to view the clinical summary, the full data included, for 72 hours. Now here's just a screenshot of our PSYCKES consent. And again, it's the best option for viewing client level data in that it includes all available data, including specially protected information for 3 years after the last billed service. Now we have a user-friendly design and it's available in 10 languages on our public website, psyches.org. Now, the BHCC consent, there's some logic behind this consent form, and it's really intended to cover data sharing by and among the BHCC and the providers within the BHCC network. Now, I want to explain what happens when you select that the client sign the BHCC consent in PSYCKES. So the first thing that will happen it will grant users at your provider agency access to that client's full clinical summary. It will also grant users at that selected BHCC access to that client's clinical summary when those BHCC users log in with their specialized BHCC access view. One thing to note is that selecting the BHCC consent will not automatically grant users at other provider agencies within the network access to that client's clinical summary. Instead, each provider serving that client has to go into PSYCKES and check off the BHCC consent checkbox in their own PSYCKES view. And the client only has to sign once, but it's up for the other providers to go into PSYCKES and attest that this consent was obtained. Access is granted for 3 years after the last billed service or until the client withdraws their BHCC consent, again, whichever comes first. And if the client does choose to withdraw their BHCC consent, the provider agency and the BHCC will lose their access to that client's clinical summary. All right, our next type of consent form is the DOH Health Home Patient Information Sharing Consent, and this includes both the 5055 and the 5021. So access to client level data via a signed DOH Health Home consent form only covers staff who work for the health home or the care management program. So in PSYCKES, a couple of criteria need to be met for the DOH Health Home consent checkbox to work as expected. So the provider agency is recognized as a DOH Health Home or CMA according to MAP. That's who the checkbox will be available for, and the users also have to indicate in their user role profile that they work for the health home administration or the care management program. So they need to be recognized in MAP, and this needs to be indicated in their user role profile that they work for the health home or CMA. And access is granted to the clinical summary in real time and will stay active as long as the client's health home or care management enrollment is verified in DOH MAP. And there is a 90-day grace period after entry into PSYCKES. Now for verbal consent, there are some procedures that need to be followed in order to obtain verbal consent from a client. So the first step is that the content of the PSYCKES consent form has to be verbally reviewed with the client, meaning that you have to explain what PSYCKES is and what information is available. Make sure it's clear that they have a choice to either give consent or deny consent, and also make sure they know that they can withdraw their consent at any time. Now, for staff obtaining verbal consent, the staff will need to complete the PSYCKES consent form by checking the I give consent checkbox if the patient agrees to give consent. And then in the signature of patient line, they would enter verbal consent with and the name of the staff person that's obtaining that verbal consent. And then they would enter the client's name in the name of patient line and enter the date verbal consent was obtained in the date line. And this completed form should be filed and saved in the agency's records, either in the client's paper chart or in the electronic medical record. And a copy of the completed consent form with the date of verbal consent should be provided to the client via mail or email or in person as soon as possible. All right, the next level of access is clinical emergency. So again, if the clinical emergency access level is selected, this will provide access to all available data, including the specially protected data in the clinical summary for 72 hours. And in terms of what constitutes a clinical emergency, we use this definition from the New York State Public Health Law as guidance. Now, the key parts and to highlight in this passage are first that an emergency condition is a medical or behavioral health condition in which the onset is sudden, so there's an immediate need, and that symptoms are of sufficient severity that the absence of immediate medical attention would result in serious consequences, namely harm to self or others. And then when using the clinical emergency option to access data in PSYCKES, it's best to document that emergency in the client's chart. All right, and the last level of level of access is attestation of service. Now, when should you use the attestation of service? So this would be for clients for whom you don't have consent for yet, or clients that you're beginning to work with but haven't yet billed for, so they're not linked to you automatically. It could be at the point of intake or during the first few months of treatment, or if the program provides clinical Medicaid services but doesn't bill Medicaid. So again, that person wouldn't be linked to you automatically through billing. Now, just a reminder, when the attestation of service option is selected, this will not provide access to the clinical summary, but this will, however, link clients to your reports and PSYCKES. Now, here's a helpful comparison chart that we have. It's going to show the type of linkage on the left-hand side, manually or automatically, the client data access type, if any client data is shown, if you're able to get access to specially protected information, and for how long. So just to review quickly, if a client is linked automatically, that means they've had a billed service in the past 9 months. You won't get access to their client data. You would just be able to see their name, and that would last for 9 months after the last service. Now, manually linking a client to you through attestation of service would only give you the client name only. It wouldn't give you access to their clinical summary. And this again would last for 9 months after their last service. Now with a clinical emergency, you would get access to client data, including data with special protections for 72 hours. With verbal PSYCKES consent, you would get access to the client's clinical summary, but you would not be able to see data with special protections, and this would last for 9 months. BHCC consent and the PSYCKES consent, you would get access to client data, including data with special protections for 3 years after the last service. And for the DOH consent, you would get access to client data, including specially protected information, as long as the client's health home enrollment is verified in DOH Math. All right, and just to review the impact of entering consent, when you select that the PSYCKES consent has been obtained in PSYCKES, then any user at your agency will be able to view that client's full clinical summary, including data with special protections. If the BHCC consent is selected, any user at your agency and the BHCC will be able to access the client's clinical summary, including specially protected data. When the DOH Health Home Consent option is selected, any PSYCKES user at your agency who has indicated in their user role profile that they work for the health home or care management program, they will be able to view the client's clinical summary, including data with special protections. All right, now we're going to talk about how to enable access to client level data in PSYCKES. So there are a few ways to do this. I'll go through each. One of the ways is through recipient search. So here you can go to recipient search on the top of the screen in that blue highlighted box. And then in the recipient identifier section, you can enter in a unique identifier such as a Medicaid ID, social security number, or a name and date of birth, and click search. And on the results page, you can enable access. Another option in recipient search is if you perform a group search. So in our example here, we looked for folks that are Health Home Plus eligible, And on the results page, you can see in the far right column, you have a link to enable access. Next is through My QI report. So here, if you drill into an indicator set and then into an indicator, in this example, we've gone into the high utilization indicator set and then into the 4+ inpatient ER mental health indicator, we'll land on the recipients tab. And in the recipients tab only, you'll be able to click the link in the far right-hand side column to enable access and go through that enable access module. The last way to enable access is through the registrar menu. So here you can go to the purple navigation bar and select registrar and then go to the manage PHI access submenu. And at the top of the page, you'll see enable PHI access where you can click search and enable access to look up an individual and enable access to their information. All right, I'm going to show the enable access module now. And just for an example, I'm going to do this through recipient search. So again, I navigated to recipient search in the purple navigation bar, and I'm going to put in a recipient identifier. So again, that's a Medicaid ID, social security number, or a name and date of birth. So in this example, I'm entering in a Medicaid ID, and I'm going to click search. And then step 2 would be the results page. So here I want to confirm that I'm looking and finding the correct client. So once I confirm that this is a client match, I can select enable access. If I'm seeing that this is not who I'm looking for, I can click modify search in the upper left-hand corner and adjust my search criteria. All right, so step 3 would be to select the appropriate level of access and click next. So we just went through all of these different access levels and what access they would give you to the client's data, if any. So in this example, I'm going to choose client signed to PSYCKES consent, but if you ever need a reminder about what each access level entails, we have this eye icon with an about access levels link that will pull up an explanation for each level of access that we have. So once I click next, then I'll see a screen to confirm the client's identity before enabling. So here I just want to make sure, okay, this is the correct person I'm looking for. This is their name, this is their Medicaid ID, date of birth and address. This is who I want to enable access for. Then you're going to have to select how you know this is the correct person. Either the provider attests to client identity or the client provided one form of photo ID or two forms of non-photo ID. And then at the bottom of the screen, it'll explain what level of access you'll get to that client information. So here we can see Main Street Agency will be given access to all available data for 3 years, and it renews automatically with each billed service. And this is for the PSYCKES consent option that I had selected. So you can either enable here to go back to recipient search if you need to enter in more consents, or if you want to perform a group search. You could also enable and view clinical summary, so that'll take you directly into that client's full clinical summary. All right, so we have developed some policies and procedures that I wanted to go over. Now, these policies and procedures were really designed to help promote the integration of PSYCKES into your agency, as organizations are advised to develop, document, and implement these policies and procedures for PSYCKES use. Now, these are just suggested guidelines and policies to help provide a framework that would establish some staff accountability and ideally integrate PSYCKES tasks into your already existing workflows. And it may be helpful to designate specific staff to do certain PSYCKES related tasks, such as confirming PSYCKES eligibility or making the consent available to staff members or obtaining and documenting that consent. So the first task that we've identified is identifying all potential PSYCKES clients. So the sample procedures here would be to designate staff who will identify who are these potential PSYCKES clients. And again, that's either currently or previously enrolled folks in Medicaid. And then you'll want to check if the client has already been consented in PSYCKES. So you'll want to obtain and document their Medicaid ID or social security number, verify their identity, and consider flagging the client's medical record for PSYCKES eligibility, or note if the client already signed the PSYCKES consent form. Now, the sample policies we've come up with are all clients should be screened upon arrival for PSYCKES eligibility, and then those eligible clients should be consented at the earliest opportunity, and the clinical summary should be obtained for all eligible individuals. The next task would be to obtain that client consent. So you'd want to designate staff who will pre-print that PSYCKES consent form and make it available and accessible to other staff members. You'd want to include that consent form in the intake or admission package, ask clients for consent and answer any PSYCKES related questions, of course, and then provide a copy of the signed consent form to the client. And think about if the client refuses to sign, when would another effort be made to obtain a signature for the PSYCKES consent? Now, some sample policies would be consent to view PSYCKES data should be requested of all eligible individuals that have the capacity to consent unless clinically contraindicated. Only the PSYCKES consent form may be used, and you can get that from the registrar menu, and I'll show you how to do that in a few slides. Or you can get them from our PSYCKES public website, www.psyches.org. A DOH Health Home consent form is available to agency users who work for the Health Home or Care Management Program. And then another policy would be give a copy of the signed consent form to the client. All right, the next task would be to determine whether there's a clinical emergency. So you can skip the step if the client has already provided their consent, but if not, you'll want to designate staff who will determine if a clinical emergency is happening, ensure that the medical record supports emergency access by documenting why and how the client meets criteria for a clinical emergency, and determine if an attempt to obtain a signed consent will occur after that 72 hours elapses for that emergency access to their clinical summary. So some sample policies would be emergency access is available only in a clinical emergency, and that there's staff specifically authorized to certify that it's a clinical emergency. A policy could be developing guidelines for what constitutes a clinical emergency. And if the client refuses to sign a consent form, but criteria for emergency access is met, the agency can still access that client's data, and that's included on our consent form. Then we have use enable access module to access the clinical summary. So we'll want to designate staff who will go into PSYCKES into one of the screens where you can select enable access. They'll want to search for the client using recipient identifiers, again, select enable access or update access, specify the basis for accessing that client's data and verifying their identity, and then they can proceed to access and or print the clinical summary. So some policies for this would be to designate which staff would use one of the screens in PSYCKES to enable access to client level data. Another policy is you cannot share Office of Mental Health OMH user IDs and security tokens. That's prohibited. And then consider developing guidelines for when and why staff may attest to client identity. And then the next task would be retain signed consent in the client's medical record. So if this was a clinical emergency, you would skip this step if that was already indicated. But if this was a signed consent situation, then you'd want to designate staff who will be responsible for retaining that signed consent and specify how, when, and where that consent form will be filed. And the policy here would be the PSYCKES consent form must be retained in the client's medical record. Next would be to print the clinical summary. So you'll want to designate staff who will access that client's clinical summary. Make selections for printing. For example, you can select specific time periods or sections that you want to print. The clinical summary could be exported to PDF or Excel or append to the PDF to the EMR. And then you'd want to make sure the PDF is being closed without being saved, or if it's saved, you're saving it only to a secure server. So some of the policies here would be PSYCKES clinical summary should be obtained and reviewed for all eligible clients. You'll want to designate which staff or types of staff have PSYCKES access, and then prohibit saving the printable clinical summary PDF document anywhere other than a secure server. All right, these are the last couple of tasks. Number 7 is place clinical summary in the client's medical record. So you want to designate staff for who will do this, specifically how and when that clinical summary will be filed. Will a hard copy be retained? Will the PDF export be scanned into the EMR and the hard copy shredded? Which section of the record within the clinical summary would be filed? Those are just some questions to think about. And some sample policies we have are the PSYCKES clinical summary should be obtained and retained in the client's medical record. Then redisclosure of confidential information is prohibited, and additional restrictions apply to that specially protected data we discussed earlier, which may appear in that client's clinical summary. And then the last task would be review the client's clinical summary. So which staff will be responsible for reviewing and when? Would it be prior to documenting psychiatric evaluation or doing a psychosocial assessment? Would it be during treatment planning with the client? Staff reviewing a printed view should have access to PSYCKES in case they want to learn more about further details. And again, the clinical summary is updated on a weekly basis, so information can change pretty frequently in the clinical summary. So some policies would be to obtain and review the PSYCKES clinical summary for all eligible clients and designate which staff or types of staff will have PSYCKES access. All right, now PSYCKES consent frequently asked questions. We've developed a script to help address some frequently asked questions and a script for explaining PSYCKES to clients. So here's just an example of a script we came up with for introducing the PSYCKES consent form to clients. You could say something like, signing this consent form will allow us to know more about your health, your medications, and the other services you receive so we can provide you with the best possible care. And then we also have some frequently asked questions scripts. So one of the frequently asked questions we get is, what is PSYCKES? So PSYCKES is an application that has information from Medicaid and other New York State databases about your health history. I don't currently have Medicaid. Do I still need to sign? You can say, if you have been insured by any Medicaid healthcare plan at any time in the past 5 years, or if you're not sure, we recommend that you sign the form. Clients can also ask, what kind of information is in PSYCKES? So a response to that could be, all services and medications paid for by Medicaid in the past 5 years are in PSYCKES. It shows who provided the service and what condition was being treated. Your record can also include your health information from other New York State databases, and new databases may be added. We've gotten this question pretty frequently. Can I see my PSYCKES health information? And you can say yes, you can provide the client with a copy of their consent form upon their request. All right, and a few more FAQs for PSYCKES is, I'm not here for psychiatric reasons. Would this consent still apply to me? And an answer to that would be yes, PSYCKES has information about your medical health history and medications you've taken. This information helps us to give you the best possible care. Who will see my data and how will it be used? So the information will be safeguarded just like your medical record, and only staff members that need the information to deliver the right care will be able to see it. Clients can ask, what happens if I don't sign the consent form? And you can say, while we recommend that you sign, your choice will not affect your ability to receive treatment or care from us. And then the last question would be, can I withdraw my consent after I sign? And yes, you can withdraw your PSYCKES consent at any time. So those are just some frequently asked questions that we've received and some helpful answers that you can use when discussing PSYCKES with your client. All right, now I'm going to go into the registrar menu. So here in the registrar menu, you can do a few different things. You can enable PHI access, so enabling access to a clinical summary, or you can print the consent form. You can also edit and enter in contact information for your agency that will be pre-populated in the PSYCKES consent form. This is the area of PSYCKES where you can withdraw a client's consent or print the withdrawal of consent form. And then you can deactivate attestation of service here as well. So I'll show each of those sections. So here's how you get to the registrar menu. It's in the top purple navigation bar, and you'll go to the Manage PHI Access submenu. And here you can see again, you can enable access, edit your details in your consent form, withdraw consent, and deactivate attestation of service. So let's go over each of these options. So the first is enable PHI access. So that's at the top of the Manage PHI access page. And here you can print the consent form, the English or Spanish versions, or you can click on that other languages hyperlink, which would bring you to our public website where we have the consent form available in 10 languages. And if you click on the search and enable access button, that will bring you up to the recipient identifiers page to search and enable access. And from there, you'll be brought into the results page and confirming identity and go through that enable access module. Next, we have provider details for consent form. So here you can add, edit details for things like improper use of PSYCKES protected health information, or who the client can contact in case they want to obtain a withdrawal consent form or submit their withdrawal of consent form. So anything you add in this screen will pre-populate when you print or access the consent form from the Enable PHI Access section. Then we have withdrawal of consent. So here you can print the withdrawal of consent forms in English or Spanish, or go to our public website to obtain other languages. And if the client chooses to withdraw their consent form, and they can withdraw the PSYCKES consent form, the DOH Health Home, or the BHCC, or verbal consent. So what they can do is click search and withdraw consent, and then you can enter in a recipient identifier. And once you enter in that recipient identifier, you can click search. And here you'll see the results page. So John Smith wanted to withdraw their consent. They signed the withdrawal of consent form. You look them up by using that withdrawal of consent search option. Here you can see on the far right, you have the option to withdraw consent. So if you click that, a pop-up box will appear, and it looks like John Smith has two different consents entered in PSYCKES, a PSYCKES consent and a DOH consent. So you can either select one or both of these consents that they wish to withdraw. So once you select them, you can click withdraw, and then you'll see a confirmation message that the consent has been successfully withdrawn for that person. And then the last option on this page is deactivate attestation of service. So here you can, if you've created that manual link using attestation of service in the enable access module, and you no longer are serving the client, or they're no longer being transferred to you like you thought they were, you can select search and deactivate attestation, enter in a recipient identifier to find that person. You'll want to confirm you found the right person on the results page, and then you can click deactivate on the far right hand side of the screen. Once you click deactivate, it'll just have a pop-up message saying, do you wish to deactivate attestation of service for this client? You can select deactivate, and then you'll see again that confirmation message at the top of the page saying attestation has been successfully deactivated for this client. All right, I'm going to go into our mobile app where you have the ability to have a PSYCKES consent form e-signed. And again, this is within our iOS mobile app, which is an iPhone or an iPad. So here is what our mobile app looks like. And right now we've gone into the mobile app, we've logged in, we've looked up an individual, and we want to enable consent for them. So here you have the options to, again, e-sign the PSYCKES consent form, which is only for the mobile app at this time. We also have the option to select here our typical enable access module options. So the client signed a physical consent, such as the PSYCKES, BHCC, or DOH consents. You can select that the provider attests to other reasons for access, such as verbal consent or clinical emergency. And if you scroll a bit further down on the screen, you'll see the attestation of service option if the client's being served by or transferred to your agency. And again, that option won't give you access to the clinical summary, but would link the client to your reports. So in this example, we're going to click on the e-sign consent, PSYCKES consent option. So once you click on that, you'll be brought to the overview for e-signatures and information about after the client signs. So here you'll want to look at the overview and look at what happens after the client signs. And then once you click next, you'll be asked, how do you know this is the correct person? So again, you can attest to the client's identity or note that the client presented one photo ID or two forms of non-photo ID. So once you select how you know this is the correct person, you can click next. And then you'll review the PSYCKES consent form within the client, so within the mobile app with the client. So this is the exact same consent form that we have on our web version of the application. Nothing has changed here, but you'll want to make sure you review the consent form in its entirety with the client so they're fully aware of what they're signing, if they choose to sign. So once it's fully reviewed, you'll tap next. And here's where the client can either give their consent or deny their consent. So in this first option on the left-hand side of the screen, client gives consent. You can select, the client will select I give consent, and then they'll identify who is signing, who is going to be e-signing this consent form, either the client themselves or a legal representative. Now on the right-hand side, if the client does not give consent, they'll select that radio button and click next, and it'll show consent was denied and pass the device back to your provider. So in this example, we're going to assume that they gave their consent, and the next screen will show a signature option. So they'll sign their name right on the device and click next. If they sign it and want to re-sign in a different way, they have the option to clear their signature right here near that next button. But once they're satisfied with their signature, you can click next. And then here's where you'll confirm to save the signed consent form. And it's also noted to work with your provider to discuss other options for receiving your signed consent copy. So once confirm is clicked, you'll see a confirmation page stating you're all set, and you can go ahead and view the clinical summary. Now, the e-sign consent form is saved in the plans and documents section of the client's clinical summary. So again, once you're on the web version of the application, you can go into their clinical summary and go to their e-sign consent form and print that or save it to their records. Now, if you want to change the protected health information PHI access level in the mobile app, you can do that right at the top of the screen. So for example, this person has PSYCKES consent, but let's say they had verbal consent and you were able to meet with them in person and you're able to obtain a signed PSYCKES consent form, which gives you full access to the clinical summary, whereas verbal consent has limited data. You can go to their clinical summary in the app and select update access, and that's where you can change your level of access to their information. And then finally, training and technical support. So we have a lot of different PSYCKES resources at our website. We have our recorded webinars, we have user guides, we have our latest release notes, short how-to videos, all at psyches.org. If you have any questions about the PSYCKES application itself, such as how do I run a certain report, or this data doesn't look correct to me, I have questions about the data, you can email our PSYCKES help desk. We're available 9 to 5 Monday through Friday at psyches-help@omh.ny.gov. If you're having any issues with your token or logging in, that's where you contact the OMH or ITS help desk. So for non-OMH and non-state PC employees, you would contact the OMH help desk, and that's 518-474-5554, option 2. But we recommend email as they tend to respond a little bit faster with healthhelp@its.ny.gov. And if you're a state employee, OMH employee, or state PC employee, you can contact the ITS help desk at fixit@its.ny.gov. All right, so that wraps up our training for today. Thank you so much for listening in, and I hope everyone has a great rest of their day. Thank you.